So today's topic is about shoulder joint. Shoulder joint is a ball and socket variety of the synovial joint, and it is multi-axial joint. Articular surfaces are head of the humerus and the glenoid cavity of scapula. Ligaments are, first one is capsular ligament. In capsular ligament, what we see is about its attachment. First we can see it is proximal and distal attachments. Proximal attachment is always to scapula and distal attachment is for the humerus. On scapula, the margins of the glenoid cavity beyond the glenoid labrum. So if it is a glenoid cavity is here, beyond the glenoid labrum there is an attachment. To the humerus, around the anatomical neck and inferiorly up to the surgical neck. You can see the diagram here. There is an along with anatomical neck here and inferiorly beyond the anatomical neck extending up to surgical neck. This is from posterior side also. You can see this is extending up to surgical neck. Communications means what all things which passes through the capsule. Here we'll see that the communications are by the subscapular bursa, infraspinatus bursa, and opening for the long head of the biceps. Okay, so these are three structures which passes the shoulder joint. Second ligament is glenohumeral ligament. Actually it is a thickening of fibrous capsule. There are three thickenings of the fibrous capsule in anterior part of the joint. Okay, in the anterior part of the joint you will see three thickenings of a fibrous capsule: superior one, middle one, and inferior one. Three areas are there where the capsule is thickened. Third ligament is called as glenoid labrum. Glenoid labrum is a fibrocartilaginous rim. If there is a glenoid cavity is like this, and around this one there is a fibrocartilaginous ring which attaches here, which called as glenoid labrum. It's a fibrocartilaginous rim, attaches to the peripheral margin of the glenoid cavity, right? And it, because its attachment there, it deepens the glenoid fossa. Third ligament is coracohumeral ligament. You can see here the coracohumeral ligament here. This is a coracohumeral ligament, and it attaches from the base of the coracoid process of the scapula till the greater tubercle of the humerus, in anterior aspect of the greater tubercle of the humerus. So next is fourth one, transverse humeral ligament. Transverse ligament you can see here, which bridges here between the greater tubercle and lesser tubercle, and it forms, below there is a bone, above there is a ligament, and it forms a osseo-ligamental tunnel in which there is a long head of biceps passes, on which it forms the bridge here. Next one is accessory ligament, accessory extra rather than the joint. So there will be, you can see here, acromial process will be till here, then there will be coracoid process here, and between there is a ligament which connects them called as a coracoacromial. Okay, I will show you here. Coracoacromial ligament is there. By this it forms on the shoulder joint, it forms an arch which is called as a coracoacromial arch. These two are considered as accessory ligaments, not exactly ligaments sometimes, but they called as accessory ligaments. Now the bursae related to the shoulder joint. There are mainly three bursae which are related with the shoulder joint. Subscapular bursa. Okay, subscapular bursa and subacromial bursa. Subacromial bursa, you can see here, this is a subacromial bursa, this is a subacromial process of the scapula. This is a subacromial bursa. Sometimes this subacromial bursa is also called as a subdeltoid bursa, right? And it's the largest in the body. This bursa is the largest in the body. And there will be infraspinatus bursa is also there. Infraspinatum, you can see here, this is a muscle called as a subscapular, and this is called a subscapular bursa. This is subscapular bursa. Infraspinatus bursa we cannot see in this image here. Next, artery supply. The main artery supply is by this axillary artery branches, which are supplying to this joint here by various branches, exactly like anterior, posterior, circumflex humeral artery, suprascapular artery, and subscapular artery. These are the main artery branches which supplies here. Venous drainage is by its corresponding veins, which are draining from here to the axillary vein, which is running here along with the axillary artery. Nerve supply around the shoulder joint, mainly three nerves are there: axillary nerve, suprascapular nerve, and musculocutaneous nerve, which supplies around the shoulder joint. 5 factors providing the stability of the shoulder joint are: first one is rotator cuff, which keeps the head of the humerus in position. Second one is a coracoacromial arch, which we have seen earlier. It prevents upward dislocation. Another which also prevents upward dislocation of the shoulder joint. Third one is a long head of the biceps, which prevents upward dislocation. And the fourth one is a glenoid labrum, which provides a protection by the deepening the glenoid cavity. Alright. Next is about movement of the shoulder joint. Since it is a biaxial, it is a multi-axial joint, it will do all the movements like flexion, extension, abduction, adduction, medial rotation, lateral rotation, and also circumduction. Okay, and in the applied anatomy we will see that dislocation of the shoulder joint is very common. Okay, it's a very common dislocation due to the laxity of the ligaments and the disproportionate articular surfaces. Correct. Initially the dislocation is inferior or subglenoid, and this followed by the subcoracoid, subclavicular, or in other areas also. Usually inferior dislocation is very common, and the axillary nerve may get affected in dislocation. You know that the head of the humerus will be there, glenoid cavity here, and here will be the axillary nerve, which is passing inferior to the head of the humerus. If the head will get inferior dislocation, there is injury to the axillary nerve is common. Okay, so this is one thing. Second, here we'll see about the painful arc syndrome. This painful arc syndrome is characterized by the chronic thickening of the tendons of supraspinatus. Okay, usually painful arc. See, this is the shoulder joint here, this is the arm, this is a 90-degree movement of the arm. Okay, this is a hand. If from the 60-degree to 120-degree, if there is a pain in the shoulder joint, this is called as painful arc syndrome. Correct. Next, frozen shoulder. Frozen shoulder is actually the tendinitis of all rotator cuff muscles, which involves all shoulder movements restricted. Okay, and the fifth one is arthrodesis of the shoulder joint, which means the surgical fixation. You can see they fix the shoulder joint they don't allow that shoulder joint to move. Surgically they will nail the shoulder joint here. Okay, and it is about 45-degree abduction and 20-degree in flexion. In that position they will do arthrodesis. Next, sixth is here ankylosis of the shoulder joint due to osteoarthritis. Okay, and there is an ankylosis will happen, right? And that will be replaced by the metallic prosthesis. What is prosthesis? Artificial parts of the body called as prosthesis. They will replace it by the metallic. See, this is a condition where the cartilage of the head of the humerus is vanished here, and the movement of the shoulder joint is restricted, and that will be replaced by, you can see there is a metal ball here, and there is a socket to the glenoid plate. Okay, so this together, if you see, it's a total shoulder arthroplasty. This condition replacement is called as an arthroplasty. There will also hemiarthroplasty, wherein which they don't touch the other one part, like glenoid cavity will be left out, only ball of the shoulder joint will be replaced. Ball of the humerus will be replaced, that is called as a hemiarthroplasty. There will be reverse total shoulder arthroplasty will also be done, where the ball is fixed towards the scapula in the place of glenoid cavity, and the plate is placed at the ball of the head of the humerus, so that will be reversed, so called as a total shoulder reverse total shoulder arthroplasty. So this is about the shoulder joint.